Welcome back. Time now to take a deeper look at a drug many are calling a game changer in the fight against HIV. This week, the Centers for Disease Control and Prevention recommended that high-risk people take a pill that is close to 100% effective in preventing infection. Courtney Keeley has details.
The drug is called Truvada, and while it's getting a lot of attention this week, it's not new. The FDA approved it in 2004 to treat those infected with HIV. Then in 2012, it was approved for preventing the infection. And on Wednesday, the CDC recommended the drug to uninfected patients who are at substantial risk of infection. In other words, Americans who are at high risk for contracting the virus. The drug is a combination of two antiretrovirals. It works by blocking the virus from entering healthy cells and then multiplying. And if taken every day, Truvada is 99% effective. But doctors say it's not a magic pill. It doesn't protect against other STDs, and people should not let their guard down.
When you have an intervention that has such a strikingly high degree of efficacy, making that available and recommending that people use it under certain circumstances, not as a substitute for condoms, but complementary with condoms, I'm very much in favor of.
In the U.S., the rate of new infections has hovered at 50,000 cases annually for the last decade. Experts believe Truvada can finally dramatically decrease that statistic. Courtney Keeley, Al Jazeera.
I spoke to Tom Myers, the General Counsel of the AIDS Healthcare Foundation in Silver Spring, Maryland, and Dr. Dimitri Daskalaskis, Medical Director of HIV Services at New York's Mount Sinai Hospital. I began by asking the doctor about his reaction to the CDC guidelines.
I think that the CDC has really empowered another very important tool in the HIV prevention toolbox by actually elevating it to the level of guidelines, which ultimately will hopefully lead to it being elevated to the level of standard of care for people at risk for HIV.
Why do you think it took so long?
It didn't take that long. Actually, I think it's actually a testament to how fast the CDC actually worked on this. We recommended for approval Truvada on the FDA just a couple of years ago, and they moved pretty quickly to put out guidance. And then about a year and a half after that, creating a guideline that was actually evidence and data-based was pretty quick for them.
Mr. Myers, I want to get to you. Your opinion, because I know your organization disapproves of the CDC recommendations.
Yes, we do. What we disapprove of is, and what we find problematic, speaking as the world's largest AIDS organization, is a widespread use and prescribing of PrEP. One of the things that's not being addressed well in these studies, or what the CDC is saying, is in each of these studies there's been a tremendous lack of adherence. This pill has been found to be effective only if taken every day. And most of the studies that have shown this efficacy, in those studies, the vast majority of people did not take it every day. The primary study is one called IPREX. In that study, 46% of all the people in the study who were given the drug didn't take it at all. There was no detectable level in their blood. Fewer than 25% of all the people in that study took it every day. And this is a study where people were paid to participate in the study. People were given monthly exams, monthly HIV tests, monthly sessions on risk reduction, free condoms. Now, that's not the real world. The real world, none of those things happen. And even in those best of conditions, 25% or fewer could take it every day. Now, the problem with that is when you don't have the daily adherence, you don't get the benefits of the pill.
I want to take a moment here to talk about a high-risk community, that is the gay community. In fact, Al Jazeera's Natasha Gonaim went down to Florida to speak to the gay community. Let's listen to the reaction to Truvada.
Here at the South Beach Clinic of the AIDS Healthcare Foundation, doctors prescribe Truvada to people who have HIV daily, but they are giving the drug to only a handful of people to prevent it.
Somebody who can't put on a condom, how likely is it that they're going to take a pill every day either?
Dr. Michael Wohlfeiler says studies have shown simply getting people to take the pill is challenging. That's why he isn't sure the drug will make that much of an impact among the high-risk population.
I really am afraid that there's this attitude that's developing, or maybe has already developed, that you can take Truvada and go out and do whatever you want. And that's exactly the opposite message of what it should be.
We spoke to a few people who take Truvada to avoid contracting HIV, but no one would go on camera. One psychotherapist who treats gay men says that's because there's still a stigma about engaging in unprotected sex. 46-year-old registered nurse Doug Steele has been taking Truvada for the last 5 years to treat HIV. He says had it been available to him prior to contracting the virus, he would have taken it. But he says it's only one tool in the toolkit when it comes to fighting AIDS.
And I think that people believe in sexual freedom, especially in the gay community. And that means, in a perfect world, you would be able to have sex with whomever you like and not have to be concerned with STDs.
A friend of Steele says without education and changes in behavior, the drug can't help the people who need it.
In life, there is no magic pill.
Wohlfeiler worries that fewer people are going to use condoms, putting them at greater risk of contracting STDs.
The reality is that a lot of these patients are using it as an alternative to condoms, and we are right, for years now we've been in the middle of a syphilis epidemic among gay men in South Florida.
Despite hopes that Truvada will be a game changer in the battle against AIDS, Wohlfeiler says the best way to halt the transmission of HIV is to effectively treat people who already have the virus. Natasha Ghanem, Al Jazeera, Miami Beach.
And there is a stigma attached, Doctor. I want to get to you. What's the biggest misconception about Truvada?
I think the biggest misconception is that it is just a prescription that should be provided in isolation. I think of Truvada as a gateway drug, in effect, to HIV and STD prevention-focused primary care. It's a way to bring people into a prevention conversation that otherwise they wouldn't be in. I would say personally in my practice, I prescribe Truvada for pre-exposure prophylaxis, and about 50% of the people that present to me asking for Truvada don't get it, but they get other interventions and other things that I have to offer to them to prevent
What
HIV.
about the cost involved?
Yeah, so the cost is actually significant. I think that the guidelines are important in changing the game. So the guidelines aren't a definitive word, but really something that changes policy and changes funders and payers. Truvada costs money. It's not a free intervention, and insurers are paying for it for the most part. But really the question is what about the people at risk who aren't insured or potentially uninsurable? And that, I think, is what these guidelines are pressing.
Mr. Myers, your organization has an incredible presence around the world. Could Truvada perhaps have an influence in nations that are battling the epidemic?
I think the emphasis has to be on treating people who have HIV. These drugs are just as effective in blocking the spread or blocking infection of HIV in people who are infected. It's up to 100%. And there are countries around the world that have gotten significant majorities of their HIV population on treatment, and you're seeing infections go down. Namibia, Guyana, Cambodia, they're all on a trajectory to eliminate HIV infections in their countries by 2020.
I know there's talk of an injectable option.
Yeah, so there are studies happening now looking at injectable pre-exposure prophylaxis that has a half-life that would make the injections really once every 3 months potentially. That could in effect block infection at probably a rate similar to Truvada. I mean, the studies haven't been done yet. They're just getting underway, but there could be a significant impact with really adherence taken off the table.
Mr. Myers, how do we get past the stigma and fight this epidemic?
In getting past the stigma, I think that we recognize that with treatment, HIV is a chronic but manageable disease. That people who are successful on treatment and adherent to their treatment, they have a healthy, normal life expectancy. They're able to work. They're able to take care of their families. They're able to not unwittingly infect others or pass on the infection. It's just another disease.
Dr. Daskalakis, final word.
So I agree with him entirely, but I do disagree with the idea of not allowing every tool in the toolkit to be used. So I believe that treatment as prevention is key. I think it's one of the central, most important aspects of prevention of HIV. But there are some people that are still getting HIV. There are some very high-risk groups where this is happening. And from my perspective and the perspective of the CDC and the WHO, we really need to use all those tools to try to curb the tide of HIV. People who are getting treated with HIV still get complications. If we can prevent HIV, we prevent transmission, we prevent complications. It's a no-brainer for me that we should not limit our access to tools in the toolbox.
This epidemic is far from over. We'll leave it there. Dr. Dimitri Daskalakis and Tom Myers, certainly appreciate your time. Gentlemen, thank you.
Thank you.
Thank you.